All right. Why don't we go ahead and kick things off? Hi, everyone. It's so great to see you all here today on this cold February day, maybe cold for some of us and not for others. Um, Thanks for joining us. I'm Natalie Graves, for those of you who haven't attended any of our events before. This is the latest in our kind of ongoing series about understanding and addressing social drivers of health. And today, the title of our event is called Weaving Together Systems and Communities to Influence Social Drivers of Health, or SDOH. And what I'm hoping to do today is provide some space away from your probably ever-growing to-do lists and boxes to check and prescribed ways of thinking, and allow some opportunity to think expansively and creatively, and maybe even dream a little bit about the different ways that we, in our roles as hospital leaders in the healthcare system, and in our roles as community members, might be able to influence these things that we call SDOH. Objectives for today, I really want to, like
Hey,
I
Mr.
said,
Shelton, this is Jesse. How are y'all doing?
I'm going to mute people
I'm
who
doing
are off mute. Okay. Want to have that space and time and conversation to reimagine our role in promoting health and wellness. So we'll talk about creative ways that we can do that build on some of the best practices that we've already discovered. We'll broaden the conversation to not be one where we're asking, what can hospitals do about social drivers of health? Which is the question we often ask, and it's a good question to ask, right? We talk about how can hospitals screen for these social needs? How can hospitals analyze their data? And then how can hospitals do something about that information? And what I want to ask or challenge us to do is think about a slightly different question, and that is, how can we collectively, as an ecosystem in the places that we live, which includes the hospital, but is not exclusively the hospital, how can we address these challenges related to SDOH? And then finally, the most exciting part of today is that we are joined by Natrina Kennedy, who is a true expert and bright light in this area. And we're going to have a conversation with her about her experience and work in this idea of bridging systems and community to advance health and health equity. Oh, hold on. I'm sorry, just a second. So before we get into that conversation with Natrina, as I was preparing for today, I felt like I would be remiss to not take an opportunity and acknowledge that we are living in a time of great uncertainty, right? And I probably could have opened any conversation or any webinar over the last 5 years, credibly, with that statement that we are living in a time of uncertainty. We've gotten used to it, we've adapted, and we've figured out how to maneuver. But in the last month or so, or recent period of time, things feel even more uncertain, particularly in our line of work. And I think part of that is because we're uncertain about both small things and bigger things, right? We're uncertain about whether or not we'll have to submit certain measures like the SDOH screening measures or the hospital commitment to health equity measures. And no, I don't know what will happen with those measures. So we'll proceed as if we will be submitting those. But we're also uncertain about bigger things like, will the funding streams that we've come to rely on continue? Will our hospitals be able to remain open in some communities? Or questions like, what will be the impact of artificial intelligence on our jobs and our work in these areas? And so everything feels a little tenuous and difficult to process. And comforting as it would be to think that one day we'll wake up and the uncertainty will calm down or disappear, I think it's more likely that things will just become more complex. Information will come at us even faster, and that uncertainty will only increase. And so our job is to figure out how to, again, adapt and function in that new world. There's one thing that I do know for certain, and that's that every single person on this phone call today who's taken time out of their schedule to be a part of this conversation cares really deeply about providing top-notch care to patients, right? And we know that providing that top-notch care includes both care in the facility, right, in the hospital, and also thinking about the things that happen before a patient comes into the hospital and after. And whether you talk about those things as social drivers of health or health-related social needs or non-medical needs or whatever terms or phrase or acronyms you want to use, we all know that at the end of the day, if our patients can't get enough food on the table, they won't be healthy. And if they don't have a safe and warm place to sleep at night, they won't be able to heal. And if they're worried that their children are going to get caught in the crossfire of gun violence, their families won't be well. And so the conversation we'll have today is, what do we as hospitals do about that? And can we prompt a new way of thinking about how we work together in our communities as part of an ecosystem to influence those needs and those factors? And the first part of that conversation is that reframing of not just what can hospitals do, but what can we collectively do? And who is part of that we, right? Who's on our team? Who else already exists in our community that we can draw on and learn from? And then once we have that broader concept of all of the resources that exist, will it change the way we think about our role or our opportunity as healthcare providers? So for as long as I've been thinking about SDOH, I haven't been able to shake this idea or this metaphor that social drivers of health and the way that they interact and influence patients and communities is a lot like a weaving loom. And this first came to me as a picture of this toy weaving loom, probably because this is one of the toys that I really liked and remember from my childhood. And the thing that I found most satisfying about it is that you take these individually flimsy little strands, right? Little elastic strands that are self-contained but can't really do much on their own. And you take the time to diligently weave them over and under one another and ultimately produce something that is not only beautiful, if you have a sense of pattern and color, but also practical, right? You create something that might protect your countertop from the hot pan that's sitting on it. And how does that happen? It happens because we weave the strands over and under one another until they're completely intertwined and can create this structure, this net, this fabric that can hold much more than any of the individual strands can before they were woven together. And so what if we think about social drivers of health and ways of influencing social drivers of health using that metaphor? Meaning, what if we think about each individual organization in our community as a strand? Each organization, whether it's a hospital or a clinic or a school or a food pantry, can do a lot of good on their own. They can be strong and sturdy and self-contained on their own. But what more might they be able to do if they work together, if they're woven over and under and get to know one another? And that weaving over and under one another will look different in every community, right? It might mean co-locating services. It might mean learning from one another. It might mean simply meeting periodically to share lessons learned and to celebrate victories and to understand needs that are emerging. The other thing we can think about is patients or people or individuals as strands as well. Because probably all of us have experienced at some point the power of the individuals in our lives in helping us, right? Organizations are, of course, important in helping to meet these needs, but just as often, or maybe more often, it's our neighbors who help us by bringing over a home-cooked meal when we have a new baby, or a friend who gets us out of the house for a walk around the block or across town when we're feeling depressed, or family members who help us move or help us get a new job when we need a little extra support. And all of those connections are crucially part of this social fabric as well that keeps all of us afloat and healthy. And so if we think about social drivers of health, then our role as individuals, as hospitals, as different care providers in influencing these things in this way of creating this intertwined fabric, to me, it becomes less of a conversation about us versus them, and more something about how do we address this complex, changing, and always room for improvement dynamic. In our data, we tend to see there are patients who have SDOH needs and patients who don't, right? We tend to think of it as a binary. But again, I think if we all step back, we realize that all of us need this net at some point in our lives. So how can we think about weaving this fabric that is unique to each of our communities based on the assets and the resources we have, and also the people that we have to meet the needs? So if you buy this metaphor, what we're going to do today is try to figure out how to operationalize this, right? It's all well and nice to have a pretty picture on the screen, but what does that mean you or your colleagues or others in your community can actually concretely do to weave together those strands? What does it look like in practice? And so I'm so pleased to have Natrina Kennedy with us today, who, like I mentioned, is someone who I have learned an incredible amount from in our many conversations together over the last few years. Natrina is a public health entrepreneur on the South Side of Chicago, and she's the founder and CEO of an organization called WHI. And Natrina will talk about her work with WHI and in so many other roles and experiences as well. She spent over a decade in community work, looking to bridge the gap between community and systems by promoting public health and healing. She has many credentials and is also actively working on her doctorate in public health at the Johns Hopkins Bloomberg School of Public Health. So please join me in welcoming Natrina. And if you have questions throughout the conversation for myself or for Natrina, please put them in the chat at any point. But Natrina, I'm going to turn it over to you and would love if you could kick us off just by telling us a little bit more about yourself and WHI and the goals that you have as an organization.
Yes, thank you so much, Natalie. First and foremost, I want to say thank you all for even having me in this space. It is an honor and a privilege to just have an open and authentic conversation with you all today. Natalie, please let me know if you cannot hear me. Awesome. Thank you. I know it is Friday Junior, and many of us probably had very busy weeks. But a little bit about myself and how WHI started. So first and foremost, WHI stands for the Women's Health Initiative Incorporated. We are a 501c3 here based in Chicago, dedicated to decreasing health disparities through education and supportive services. Most of our target population are Black and Brown women between ages of 15 and 45. And I actually started this organization fresh out of undergrad at Loyola University of Chicago. I was very, very naive, probably still a little bit, but I'm very naive. And the whole premise of this work was centered around increasing access to quality healthcare services for women, primarily through obstetrics and gynecology. What ended up happening was the organization took an entire different direction. We started working with women in the community, and long story short, they're like, yeah, that is not our problem. We go get our pap smears, we get our mammograms, we've had babies, we know what to do. And what we found to be true is that we were trying to solve problems that we thought were prominent in the community. And so what I did was I created this community network. Any woman in the community can join. We now have a network of over, I think it's 350 women, primarily from the far South Side. So if you're familiar with the South Side of Chicago, it's very, very big, but we primarily focus on the far South Side, which encompasses 4 different zip codes here in Chicago. And ultimately, what we found was they were having a challenge with just their everyday lives. Like they were experiencing a ton of racism in their everyday life. They were having a hard time with childcare, and they felt really, really isolated and alone in a lot of their challenges. And so what we began to do is just create spaces for them to just commune together. And what we found was that was way more popular and significant and impactful than any of the other events, programs that we were putting on at the time. And so one of my interns a couple of years ago created what we call a storytelling session, where we partner with local Black and Brown businesses, mostly like coffee shops, galleries in the community. So they're in the neighborhoods where these individuals live. to just come into the space to learn and hear from health systems leaders, clinicians, each other, and they found it very impactful. So we've slightly shifted. So to answer your question, Natalie, we're still working around ultimately like decreasing health disparities, but through the assessment of lived experiences and storytelling. And so really thinking about these stories as a form of qualitative data and information that we can use to create an evidence base for future programs and policy here locally. It's been a very, very different shift from the original creation of the organization. We work with over 100 different organizations here in Chicago. And ultimately, our plan is to begin to take these stories and experiences and turn it into policy and action. We're hoping to scale this work. I'm also working with Johns Hopkins, my university, to also think about that sustainably. But it's been amazing. We have not actually been fully funded. So all of the work that we do, all of the support that we get comes directly from the communities that we serve and support. It has been amazing. I'm also a member of the community. So I live in a community. I am one of them. Everybody on my board also lives in a community as well. And they have expertise that's different from mine. But ultimately, our goal is really to empower individuals at the hyperlocal level to really, really create a movement in a way that bridges the gaps, not just within community, but externally with the systems as well.
Thanks. Where do you see alignment between your goals now or as they've evolved over time and the goals of the healthcare system?
I think the short answer would be overall health equity, right? When you think about health systems, and I've also worked in the health system as well, um, we think about helping people create healthier lifestyles, helping them understand the social conditions in which they live, and also creating a community amongst them, right? At least in my experience, we've also heard that a lot of them don't get to spend a lot of time with their clinicians. They don't understand the system, and the system don't understand them. Um, when I say systems, when I say systems, I am mentioning healthcare payers, hospitals, payers, agencies. So in my line of work here at the hyperlocal level, we kind of batch those into one one conglomerate because we work with several different versions of that. But ultimately, I think the alignment is health equity, right? We're working towards the same goal from very different lens, and there's different vehicles to doing that. And so historically in my work as a nonprofit founder, we've been the engagement that the hospitals can't really do in their day-to-day work. We've also help them understand deeply some of the problems that they might be seeing even clinically. So for example, we've worked with a local health system who has community health workers, and so they needed an extension of that. And so we're not clinicians, but we have conversations and we have access to the everyday experiences. And so I give a small example. We had an individual who was having issues with diabetes. And for the longest time, they were trying to figure out why. She's coming to the appointments, she has access to transportation, they're going to her house. And ultimately, there was a health literacy component that was missing. When she was taught how to get her insulin, she was taught using an orange. And so she thought that she could eat the orange. And so it was through conversations and through the storytelling sessions and other situations that she was able to learn from her peers, like, no, you're not supposed to eat the orange. And so we were able to kind of be an extra layer and cushion between us and us being community in the systems. And then culturally, I think nonprofits and community-based organizations are also able to tailor interventions a lot differently. In my experiences working alongside the systems and in them, there's a lot of bureaucracy and red tape that exists, which eliminates a lot of the work that can be done, or if not eliminate, create a lot of barriers to what can be done, which a lot of time in my space as a nonprofit founder, we don't have as many opportunities and red tape to not get the work done. So we have different barriers like funding, things of that nature. And so I think we're working toward the same goal of reaching health equity and empowering community, especially at the hyperlocal level.
Yeah, you gave such great examples of areas where you were working towards the same goal and took complementary approaches, right? Contrasting challenges the system might have versus ones you can support. Do you see that there is ever a disconnect between the goals that you have and the goals that the system might have? Or what advice would you offer for someone who felt like there was a disconnect between what their goals were and what, let's say, community organizations' goals were, and how to navigate that?
Great questions. I will start backwards. So the advice that I would give, and it might seem simple, is to meet people where they are and be okay if you're not there yet. Especially in the nonprofit space, as I mentioned, we often have to kind of pause our work and sometimes just do simple things like meeting in a barbershop or doing things at a local coffee shop. And it may not seem impactful compared to the larger scale of things that can be done, but it's movement. And so that would be what I would say to someone who is experiencing a disconnect, is meeting people where they are and being okay if you're not there yet. There's always something to be done. And so as long as you are doing it in a meaningful and authentic way, you're doing something. The second thing that I would say, as it relates to not the disconnect. So in my experience with, and this is my personal experience, so I'll give that as a disclaimer. In any instance where the system was in a different place than the community-based organizations and what we were working towards, it was because they didn't understand community, not because the goal was different. They had a different understanding of what maybe the problem was or how they wanted to, the totality of situations that were happening, which is a privilege when we work in systems, right? Like we see things from a very grass tops perspective, which may be different. And so I could give a small example. We worked with, WHI worked as a part of a collaborative convening with local community college, and then also like the city of Chicago and other nonprofits. We all came together, and it was around a maternal infant health problem that was happening on the south side of Chicago. Some of you all on the call, if you're familiar, you might have heard of it, but ultimately there was a huge issue with postpartum care. So a lot of women on the far south side who were receiving care during this very specific time in the state of Chicago were having there was a reduction in them visiting their postpartum follow-up. And of course, as a result, there was a lot of issues, postpartum complications that weren't getting addressed and so forth. And what we found was there was a local train that was running at a new time. And so if you were getting picked up by a bus, so CTA, you will be late, they'll be late to their appointments during a certain time frame. And so it literally just was a conversation that needed to be held with transportation, which is CTA, and community-based organizations on how we can support moms who don't have access to transportation other than CTA. And so the disconnect was that we weren't talking to each other. Everybody was trying to solve the same problems, but we all had different pieces of the puzzle. And so I think working to solve that is just literally being at the table. And if you're not at the table, doing your part from which the angle that you can actually tackle it. And so for us as a community-based organization, that's simply just being in community. So a lot of times I don't have money or funding to do programmatic work across the entire city, but my board and our volunteers, we can go and we can sit and have conversations.
Yeah, what a great example. And I think so nicely illustrates the point I was trying to make about taking that broader view of not what can a hospital do, but what can we all do collectively? Because so often the challenges that we see at the sharp end of healthcare are driven by these external things. And if we come in and try to say, oh, let us fix this thing without understanding those different factors, at worst, we won't fix the issue. And at best, we might spend a lot of money and waste a lot of time in ways that, we could have done it a lot more quickly. So excellent example of just kind of stepping back and looking from different perspectives and getting all those people at the table. We have a lot of folks on the phone who I think are probably in roles where they're responsible for teams who are completing the social drivers of health screenings with patients. And they're seeing patients who come in who have, any variety of needs, and they're trying to understand, how do we build new partnerships, or how do we get to know the nonprofits that might exist in our community, or the folks in our community who are doing things that we're not even aware of yet? And how do we even start that conversation about, how do we even like get to the table in the first place? So what would you say to folks about, what would your ideal partnership look like? Or what are some of the key elements that make a partnership between system and community, or, system and nonprofits, however you want to frame it? What are the key elements that make a partnership impactful?
I love that last question. I think a few things here. I first want to start off with saying that I think that in order to get people at the table, you have to know that they exist. That's the first thing, right? And then before I forget, this is something that I really, really want to highlight, because an individual or an organization or entity, they can be at the table, but are they speaking at the table? Is there a power dynamic in place that gives an opportunity to vocalize and share their expertise? A lot of times what I found is, especially with the larger systems, they invite the individuals in, but they're not holding space for them to share their knowledge and experiences in a way that can actually help. And so being mindful of the power dynamics, I think, are huge, especially when you're bringing in community-based organizations who have a different set of skills and gifts. That's the first thing I wanna say. The second thing is we've found that the simple way works best, right? So utilizing the tools that you have in a meaningful way. I'm also a corporate strategist. As Natalie said, I wear many hats. And in my strategy hat, a lot of times what we do is we simply do Instagram searches, Google searches, zip code searches, right? What organizations exist? Have we met with them? Sometimes we don't have a lot of experience or with actually like certain sectors of community. Like for me, I haven't worked a whole lot with behavioral health. So I don't know a whole lot of scope in that space, but we still invite them in. You tell us what we're not thinking about. And then sometimes we don't have enough time. A lot of us have busy work schedules. We're in meetings all day. So bring them all in together. Right? It's been times where we've had like 50 different organizations in one space, and they all think differently and work differently. And we use that information, and when we have time, we dissect it. What can we do with these individuals? Or can they take a load off of us, right? So in some cases, I've worked with organizations where they don't have time to analyze data and stories, and we do. And so making sure that it's a bi-directional relationship that is fruitful to both sides in a way that impacts community. And then also working towards a shared goal. So some of the things that I think are impactful to a productive and fruitful partnership are things that you mentioned, Natalie, right? Level setting, what is the goal? What is the purpose of the work that we're trying to do? What is the target audience? Are we all working with the same different target audience, right? Or are we all working within different populations and our shared goal is something totally different? So thinking about the purpose, thinking about the goal and the targets. And then also, I think this is something very simple that I've noticed a lot of organizations don't use, but charters. So having something in writing that spells out all of that. I've been a part of coalitions where you might have food depositories and CPS and schools and agencies of all kinds in one coalition. And they have no idea what the other person is doing, but the charter is what kind of keeps everybody centered and working collaboratively. Making sure that you're being useful of the meeting times that you have. So I'm sure we've all experienced that, where we're just putting meetings on the books and you're wondering like why nothing is happening. So making sure that there's actionable things that can come out of the meetings, but you have to have a shared goal. Otherwise, you can't put forth a strategy, you're working blind. And so I would say starting off with a shared purpose, getting your goals, and then your target audiences and your charter. So something in writing where everybody's on the same page.
Yeah, that's great advice. I think it's easy to forget, particularly when we have people from different sectors and backgrounds and areas of expertise. We all have different languages, right? We use different words, different acronyms, different phrases to mean different things, and we might use the same words to mean different things. And so it becomes even more important not only to have that shared goal articulated, but to be open to learning and understanding and challenging yourself on, am I really hearing or understanding what this person is saying? And being open to that learning piece, I think, is huge, because the point is we don't have all the answers as a hospital, right? Like, good, great, come on in and tell me how we can work together differently, which I think is freeing in some sense, right? Let me see. We also I work a lot with hospitals, and I'm sure we have folks on the line today who, especially in rural communities, feel like they just simply don't have resources, right? Or don't have enough resources. Maybe there isn't a shelter, or the shelter doesn't have enough beds, or there isn't a food pantry, or enough resources simply don't exist. And I know that is probably something that you run into as well, right? I think any community we're in, we never have enough. So what advice would you offer to folks who are feeling like resources simply don't exist? So how do I move forward? Or what could my next step be?
I think what I would say to them is to take an asset-based approach. That is my bias coming out a little bit, though. I feel like, especially in public health, we're taught to do needs assessments and worry about what we don't have. And we don't spend nearly as much time looking at the assets in which we do and how we can optimize and mobilize those. And we've seen it all the time, because sometimes when we're not in a state of thriving, we have to survive, right? I live in the Roseland community, and I can tell you right outside my window, one of my neighbors is literally hosting a a farmer's market on his front porch right now, in probably 10-degree weather. And so he probably reaches more people than the local shelters, just because of like proximity. And another example is, like, in my community, we don't have grocery stores. And so a lot of the liquor stores sell groceries in our community, and the churches give out food, right? And so those are assets that are being utilized in ways that, and probably more than even me or some of you all may know, that I think are opportunities for us to actually do more with. So that would be my initial and natural response. The other thing that I think I would be remiss to say, if I didn't share this, is one thing I think is meaningful to partnerships too, Natalie, is having community in the conversation as well. And I've done that where I've always taken, whenever I go out, and whether it's meetings with different agencies, speaking engagements, we always take a member of the community network with us, because they're going to understand the problems, the solutions differently than anyone at the table, because it's something that they're experiencing in real time. And so I think that's really important. So when we start talking about resources and what's not there, they'll also let us know how we can use what we have. Even, like, for example, the galleries. A lot of the galleries here on the south side of Chicago, they are community owned. Had no idea that. I have one down the street from me and didn't even know that. And so when the mothers group need to get together, they go there, because there is no hospital within 20, 30 miles of my home. And so I think optimizing resources that exist and taking an asset-based approach, and realizing, sometimes we'll realize that we have more than we think. And what we don't have, that's where the partnerships can come into play. We've had people from other states and cities come and support us. They may not have money, but they have time. So they'll come and do events with us.
How do you find out about those assets if you are just getting started? It's not just Googling, right? And it's not just looking at your local 211 or Find Help website, which are all great resources to start. But how do you start to access that network and level of really hyper local resources that exist?
This might sound very basic, but what we did here with my organization, we literally stood on the corners. And when I say corners, I mean like bus stops and red lights. And we observed, and I say we, I'm literally referring to me, one of my board members, and a couple of volunteers. And so if you sit on the bus stop all day, you'll learn about, hey, where are you going? What's happening? And that's how we began to find out about resources that we had not experienced ourselves. As I mentioned, my organization is slightly different because we're all from the community in which we serve. But as we started to expand and think differently, we did simple things like that, like literally sitting on bus stops and just exploring and having conversations with everyday people. And you do get a couple people like, yeah, I don't want to be bothered. Why are you talking to me? But then also too, I think another thing that has been really powerful to me is the other community-based organizations, the openness and willingness to share knowledge and resources. I would say outside of like that ground, boots on the ground engagement is also the other CBOs. It's other founders who have emailed me, hey, did you see this grant? Hey, did you want to come to Agape and play with the kids? Or did you hear about this? And it just grows and expands because you're able to tap in just through word of mouth.
Once you're in it, but you got to get in it.
Yes. And I would say to get in, you just have to step your toe in. And like I said, it may not be as fast paced as you like. It may not be as impactful as you want, but it is a start. And so what I found and amongst the entrepreneurs that I know, I'm one of the youngest. So I feel like everybody's also always like, hey, did you try this? And what I found is the simplest things that go very long way, a very long way. Even simple as like sometimes the farmers markets, or even just like I said, like being on the bus stop. These are people who need resources, right? If somebody's on the bus, not all the time, but at least in some cases, they might not have a car. Why don't they have a car? It's because they choose to, because it's too expensive. Then you start learning about economic problems. Then you start learning about like some of the health problems. We ran into homeless people and they've given us some of the most traumatic stories, but they have access to a lot of resources, right? And they know about different things just because of what they're experiencing.
Yeah. Last question before I open it up for others. You talked about this a little bit and at the beginning as well, your work around helping to translate people's lived experience into influencing systems change. So can you talk about that more specifically related to hospitals, meaning what can hospitals do to more effectively engage or welcome in or hold space for patients or community members to be part of those conversations, to inform changes that might occur at the hospital?
Mhm. I think that's twofold. One is opening up the space, right? Which, depending on the hospital, can be a little bit bureaucratic, right? I recognize that. But the second thing is stepping outside the hospital walls. And I know that could take time, but we found that both of them are needed in order to create and hold that space. A lot of the nonprofits, both myself and the majority of the ones I work with in community-based organizations, we don't have space, right? So we have the people, we don't have the space, and hospitals have that, right? And so they can organize and be a part of that movement in that way. But also, what I found to be more impactful than them physically holding the space is to be in the spaces with us in community. We've hosted recently at least 5 different health system leaders, and when I say leaders, I'm referring to like director roles and higher. Um, and they've never had conversations with people in community. Um, and so we've just literally had coffee with them. Come talk to us. And so being open to being in those spaces, we found that, and actually, Nyla, I'm sure you remember PFCC. I learned this from them. The importance of having a teachable spirit, right? There's a level of humility that comes with saying, I don't have the answer and I'm willing to just go and get it. And so coming out and out beyond the hospital walls and saying, hey, like, what do we need? Right. And so we've seen here, I'll be very fair, we've seen here a lot of the hospitals in Chicago have really been expanding. University of Chicago Medicine, we're seeing them more and more open up urgent health clinics. That's been very, very impactful to our community. But that came out of like listening sessions and just like some of their community-based work. And then we've also seen Advocate and Christ, even CVS Health, step outside their just their spaces, their normal traditional spaces, to really become innovative and work with community. So those would be like my natural responses to that question, Natalie.
Thank you. Why don't we open it up for any questions from the group? If you want to come off mute and ask a question, you can, or put something in the chat. I'll be quiet for a minute to see if anybody wants to ask Natrina anything. Or if anyone else has examples or experiences you want to share, or lessons learned from work that you're doing with community or with partners, please chime in as well. Natrina, do you have questions for the group?
Actually, yes. I am curious to see what types of challenges or successes have been impactful. Thank you, Karen. What challenges or even successes have you all seen in your line of work as it relates to social drivers, community health, health equity? Sometimes it's helpful for us to just kind of stay in the know.
Thank you for everything that you have said, Natrina. Very interesting. And one of our successes here at the Dallas-Fort Worth Hospital Council was quite a few years ago, but we noticed one area of town had a really high rate of diabetes. So we went to that part of town. We had the community meetings, like you said. You know, we had all these preconceived notions of why we thought that rate of high diabetes was there. And after meeting with the community and resources that were available, well, we asked them, you know, do you exercise? Well, no. We thought, okay, are there not sidewalks? No, it's the stray dogs. They are chasing us. We can't go outside and walk. So we got with the city of Dallas and had all of the stray dogs picked up and rehomed, and we saw a decrease in the diabetes, but we never would have thought that if we didn't sit down at the table with the community and the people that can make a difference. So thank you for reiterating that that's important.
Thank you. We have that issue here. And it's so funny because I feel like the cats are kind of taking over now in my neighborhood. And we've had random, like some of my neighbors, they've randomly just gone out and started picking them up. And we thought that they was going to take them to like the kennel. And actually they brought them back. So they just got them their shots and stuff. I'm like, you brought them back. And they were saying like, because it's actually helpful to our block for different reasons, because it keeps one, crime, but also other animals off the block. And so they actually brought them back to the community. And I was like, that was interesting. I never would have thought about that.
Yeah, learn something new every day.
Mm-hmm.
Patty, thank you for sharing. That's a really great example too of the graphic we have that I know I've shared on other webinars of the bridge from data to action, right? And the idea that often our instinct is to take some data, like our screening data, and say, okay, we know what the issue is, so let's go do something about it. But there's this really crucial middle step of having that conversation with the people who are affected, right? To really understand what the issue is, not just we see high rates of diabetes, so let's build a grocery store, but go through that process of what is the real driver there. So excellent example. Who else? All right, well, why don't I have a couple slides to close us out, and then if folks have questions, put them in the chat or interrupt me at any point. First, thank you so much, Natrina. Every time we talk, I learn so much from you, and I so appreciate your calm and deliberate and diligent approach. I feel like the advice of it might not be going fast or as fast as you want, but just keep taking one action that you can is really what I needed in response to the craziness of the moment. So thank you.
Thank you for
I'm going to
having me.
share my last few slides. So here we go. Okay, a couple of announcements about our next events that we have planned. The first announcement is about something new on the Convergence website. So we've recently launched a blog, and the blog so far has a couple of posts about social drivers of health. It's really some reflections and thoughts about things that I've learned and observed and taken away over the last few years of doing this work. So there's actually a post on this idea of weaving the fabric of community, kind of probably a more eloquent write-up of what I tried to say at the beginning of today's session. There's a post on recommendations for increasing buy-in among your team and your staff for screening for social drivers of health, and a couple other ones as well. So check it out. Let us know what you think. And then up next, what I'm hoping to do, and I want to get a pulse from the group today and see if there's interest in this idea. But what I've heard in recent conversations is that many of you have data now, right? You've been doing these SDOH screenings for a year or more now. You're probably getting ready to submit your screening data to CMS in the spring. And so you're sitting on this really rich resource now that you can aggregate and step back and look at and see what direction it might point you in. And at Convergence, we like to use the word sense making for any data, which really is trying to figure out, okay, so we see some numbers, we might see a graph, but what does it really mean? And to me, inherent in the idea of sense making is that journey of going from what does the raw quantitative data tell us to how can we supplement that with the qualitative data, the lived experience, going to really understand what the drivers of those outcomes are. And so what I would like to do is kind of a workshop style session where folks would come to the meeting having done a little bit of pre-work. And so what I would do is share this template around. It's like a 4-slide template where all you would have to do is put whatever SDOH data you have in here. So put a graph in of whatever you have, put some notes down about what your discoveries were, what you learned, put some notes down about what your challenges are, and then put some notes down about what your next steps are. And if we could have, let's say, 5 or 7 people put those slides together and bring them to the conversation, we can have more of a workshop style share out to say, here's what we did, here's what we learned, here's where we got stuck, what are you learning, or what can we do next? And I've done this with states, and I always find that it's much more useful for folks to come together and share the specific challenges that you're facing versus me just talking more about the templates you can use. So if you're interested in this idea, I will drop the registration in the chat. If you want to send me a note in the chat or on email as well, if you think this sounds interesting or useful to really get into looking at your data, I would love to hear if this sounds like a good idea or if we should go a different direction. And I don't know if I'm going to have the link handy, but I'll send it around. Any initial reactions to that or questions before we wrap up for the day? Otherwise, we will send everyone on their way. Okay. Well, thank you again so much, everyone, for joining us today. And I hope you took away some different way of thinking about the way that you can partner with your community or start to think about resources you can offer or the impact that you can make. And I hope you all know and remember that every single conversation that you have with patients does make such a huge impact and change. And every little thing that you do, even if it's just listening empathetically to the challenges someone is navigating, really makes a difference to patients. So thank you so much for that work day in and day out. And I hope you all have a great rest of your week. I'll see you again soon. Take care.